network. When we speak with practices, the main problem that we're focusing on is excess use of the emergency room for non-emergent needs. And specifically, we've been focusing on what we call low acuity non-emergent visits, or lane visits. And this is a concept which is out there in the literature, which many people may be familiar with. And although it can be defined in a couple of different ways, the definition we've adopted is that a lane visit is for a condition where a several-hour delay really wouldn't cause significant harm to the patient. And other groups have shown that the most common reasons for these lane visits include musculoskeletal pain, cough, rash, sore throat, urinary tract infection, and vomiting. And we found that was also the case in our own network. We've also, if you could go back, please. We've also found that about 25% of emergency room visits are for these low acuity needs, and they're occurring pretty much every day of the week. One thing that's been important to emphasize to practices is that these are not only occurring after clinics are closed or on the weekends. As you can see from this bar graph here, which demonstrates the percentage of lane visits by day of the week, if you just look at Monday through Friday, half of the emergency room visits for low acuity needs are occurring during normal clinic hours. So what are the drivers of some of these visits? Well, part of it has to do with individuals being unsure where to seek care for particular problems. Another may be limited office hours, particularly on evenings and weekends. Very commonly, there are not good systems in place to provide advice to patients when they need it or to help them appropriately triage their concerns to a clinical setting. Sometimes practices are actually sending patients to the emergency room, maybe without the knowledge of the physician or other healthcare professionals. It might just be part of an administrative triage process done by the front desk. Let's face it, sometimes the ER is an easy place for patients to go. If they feel like they need an X-ray or a CT scan, it's one-stop shopping. Or patients may actually be closer to an emergency room. Or if your city is like mine in Nashville, there are billboards up along the freeway showing the visit, how long the wait is in ER waiting rooms for those advertising hospitals. And there are also other more complex reasons driving ER use, which include poor care coordination. And certainly a portion of patients have complex social or behavioral health factors that also affect their healthcare utilization. What are the consequences?